Research tells us that about 30% of men and women live with chronic or persistent pain, and that's a figure that gets higher as we get older. And the current thinking about how to manage chronic pain suggests that self-care, self-management is really important, but the self-management needs to be flexible and adaptable to your situation. And I think that's where mindfulness comes in. Because mindfulness is a skill that you can cultivate to help you relate to your experience and to your life in ways that reduce suffering and support you in getting the most out of your life. And part of the process when you're working with chronic pain is to understand what causes pain and what makes it worse. And to this end, last month I talked about 3 of the misunderstandings that can cause us to have more pain or to get stuck with pain, and how mindfulness can be used to address them. And in the last video, I talked about issues to do with whether pain really is synonymous with tissue damage, whether the intensity of the pain can be used as a guide to indicate what's going on in the tissue, and also this notion that there really isn't one size fits all to how you manage it. Today I'm going to talk about two further issues. One is to do with the role of getting a diagnosis and whether that helps you know what to do next. But also this notion that all you need to do is find the right position or the right movement and you'll be fine. And I'm going to say a bit about how mindfulness can help you navigate pain skillfully, and I'm going to share some ways for you to get started practicing. So thank you for being here, and I invite you to join me on this journey through the intricacies of pain. And I hope from it you'll get the idea that actually you have more control over your experience than you realise. Your brain's a great problem solver. And like any strength, it can be a weakness too. And it's really easy when you have pain to finish up going down a rabbit hole of testing and searching for a diagnosis and ending up building up a library of results and reports, all of which unfortunately may not amount to very much, apart from time, expense, and frustration for you. In some of the most common persistent pain syndromes, there really isn't a pathology to find. More than 90% of back pain, for example, is non-specific. And even when you arrive at a diagnosis, fibromyalgia, neuropathic pain, that doesn't mean you necessarily know what to do next. And this is where I think the mindfulness attitude of letting go or letting be can be really helpful, because it does support you in being at peace with not knowing. And trust me, as human beings, we don't like to not know. It's easy to understand why we have a desire for a diagnosis, because a diagnosis can give you hope, it can give you a sense of control, it creates a sense of certainty, but it can also increase your stress and anxiety, affect your sleep, make you feel depressed, and all of that can actually make pain worse. One way to practice letting go or letting be is to devote some time to being creative. And when I say creative, I mean it in the broadest terms, whatever is meaningful for you. Maybe you like to bake. Maybe you like to stitch, to write, to paint, to garden. Maybe you like to just make things. Take a break from your normal routine. Get yourself into the flow of doing something you really love. If you can do nothing else, step outside and look up. Change your gaze. Move your focus to something further away. Because literally and figuratively, if you change your focus, you are helping your brain to calm down and to rewire in more productive ways. If you just rely on some of the commentary on social media, you could be forgiven for thinking there's one correct posture or one movement. Notice I didn't call it exercise. That's the be-all and end-all for managing pain. And most people I work with have already been given programs of exercises or told to walk, swim, cycle, do yoga. And most forms of activity will have their advocates. And the truth is, movement does seem to help. Although the impact sometimes on duration and intensity of pain can be limited. But it doesn't always help over the long term, and sometimes it doesn't help you do more on a day-to-day basis. And frankly, most people find regular programs of exercise hard to stick to. Now, in mindfulness, we have an attitude that we call beginner's mind. And this can help you find the movement practices that work for you. And with beginner's mind, you just try to reintroduce some curiosity, almost as if you're seeing a situation for the first time. So, in the case of using movement for pain, instead of buying into any generic advice, ask yourself some questions. What do you enjoy doing? And start there, and start with something low intensity and build up. Because you know what, it's easier to stick with something if you enjoy it. What would fit with your lifestyle? Because some people are great with regular classes, but if you travel a lot, it might be better to find an approach that you can do in your own time and take with you. And some people prefer to have something that they can just work on their own. So would you like to be working on something on your own, or would you like to do something in a group? What's going to help you the most? And what about accessibility? When I say accessibility, I mean price, location, any equipment. All of that can play a role in what's easiest for you to do. And you might also want to ask yourself what outcome you want. Because it's often easier to find the right movements for you and to stick with it when you have a very clear idea that there's an outcome that you want. And keep a very broad definition of what counts as exercise or movement, because it does include things like doing the housework and working in your garden. And don't forget to have fun. Because reducing pain with movement is more about consistency and what's right for you, rather than specific activities or exercises. Thank you for joining me on this exploration of pain and just how slippery it can be. If there's anything that's caught your interest, please do get in touch to ask questions and to know more. And follow me on social media. for more on persistent pain and ways to reduce symptoms and live well using mindfulness. Thank you.